So for me as a lymphedema therapist, I get a lot of clients who have lipedema, which
Mm-hmm.
fall into the bariatric
Yeah.
population. Can you talk about some of the challenges that people who you say have the bigger bodies have with just basic self-care and basic mobility?
It's a lot, right? So like, what is it? 1 in 9 women in America have lipedema of some kind. So
Mm-hmm.
it's everywhere, and it's not, and it's a medical condition, right? So even you can
Right.
be the teeny tiniest small frame person and still have this issue, and it comes down to, can you move, right? So sometimes, like, I have somebody right now who has a very, very large growth on their leg, and so it limits their mobility. So we're working on ways to move about their house, to get on and off the toilet, to get in and out of the shower. We do a lot of adaptive equipment for people. I do a lot of pericare training for people, and adaptive tongs and different ways to kind of clean yourself, and educations on bidets, right? Bidets are
Mm-hmm.
big.
Hmm.
Um,
Right.
and
Right.
and cleanliness, right? So making sure
Hmm.
that when there's folds, getting in there and cleaning things. And so there's a lot of education pieces to it. And that's kind of what we do as OTs, is teach people basic daily living skills. And sometimes you have to think a little differently for things like that when you have growths or extra areas that maybe are out of the norm and don't fit, right? So fitting in a regular chair, you've got to worry about now a weight requirement in the chair, or where the armrests are, because that part of your body doesn't fit in there. So it's really kind of breaking those things down, and looking at what we can do to modify those things.
Okay. Do you have like a go-to list of adaptive equipment that you show people, or do you just kind of, as you see people, give them ideas of adaptive equipment that they could use?
Try to be really careful about generic, like, oh, these are all the things I use. I do have a list of things I have on my website for people to kind of look at, but I try to be very specific and intentional, because
Yeah.
after years of being an OT, right, people have closets full of all the adaptive equipment that somebody recommended, and they don't use them because they either don't know
Right.
how, or they can't. It seems like a good idea at the time. So I try to be really intentional with that, and be very specific with the person that I'm talking to. Like, hey, there's 20 million things that you could use, but I really think this one specifically will work for you because of this, and this. But um, those long handled items really come in handy, like the sponges and things, especially when you're trying to get in those kind of cracks and crevices to make sure things are dry, and so you don't get the chafing, and you don't get the rashes, and you don't get the skin breakdown. So a lot of those things
Mhm.
are really big. And so those are kind of my go-to, that almost everybody that I see that's in a bigger body needs those things. But for the most part, I try to be very specific and intentional about what I recommend.
Right. I find that a lot of people who have those folds, those lobules, skin on skin, under the breast, in the groin, they're not educated on how to take care of themselves and to make sure that they don't get the funguses and things. Can you talk about any experiences that you've had, or with people that just really are ignorant about their skincare?
Yeah, it's really about making sure things are dry, really, because it's when you get that moisture in there, that's when everything can go bad very quickly. And when you get those wounds, it's very fast, where you get things that are open and infected, and then end up in your stream, and then you end up in the ICU, right? So it's really about making sure that your clothes are dry. And then, if I have some people that are very profuse sweaters, right? So they're changing their clothes a lot, they're changing their undergarments a lot,
Mhm.
especially when they've got larger pants areas. Really, like, underwear gets wet really fast, and I'm in the Midwest, and I mean, you're kind of in that humidity area as well, right? So you
Like
you you can
71 day, 40 the next day. I'm in that middle where we don't know what the
right, and you never know. And,
yeah,
we had a day here
right.
where it was 80 degrees one day, and the next day it was snowing, and literally in 24 hours. And so, things like that,
Right.
especially when you're in areas like that, where you're going to be sweating more, and you're out, and just even walking to your car, you get those things. So you
Hmm.
really need to pay attention to those things, and making sure that you either have extra padding that you can change out, or extra garments, especially with like lymphedema and wrapping and those kind of things. We want to make sure that garments are clean and dry. and laundered properly. And then, everybody's always worried about smell too, but you have to be really careful with scented lotions, right? Because the things that make things scented can cause other issues too. So making sure that you are talking to the professionals like you or like me that really know the things that are out there that are going to help prevent things and not cause more problems. Like, it may be really great to go to Bath and Body and things smell wonderful in there, but those are not the lotions that you want in those special areas. You can put those on your arms and around your neck and all those kind of things, but in those kind of sensitive areas, you want to be really careful with anything that's scented or those kind of things.
I often will recommend Inner Dry for my clients. Are you familiar with Inner
Mm-hmm.
Dry?
Mm-hmm. I think
Yeah,
that's great.
yeah,
That's a big one for sure.
yeah.
And there is a lot of stuff out there, but you have to be careful, right? Because most people get all of their information off social media now, and they're not talking to people that are really specific and educated in those things. Like you and I are, we CLTs, we understand those things, and sometimes you just get somebody random on TikTok that's like, "Oh, this is a great lotion, you should use this," and you're like, "No, no, 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 don't use that. Please don't use that." So
Yeah.
it's you got to be
Yes.
really careful where you get your information from. So the internet is great; it's wonderful. There's a lot of things out there, but you really need to be really cautious about some of those pieces of information and items that you decide that you're going to grab off the TikTok shop, right?
Right, right. You guys check the source. Who's
Yes,
putting it
check your
out there,
source.
right?
Always check your source.
Yeah.